Um, I'm okay. Somehow I lost your video.
Oh,
So my I'm having this discussion on behalf of eDot Health. So eDot Health is an aggregator, a digital health platform where they are trying to aggregate, trying to bring in all the entities of healthcare. That means patient, doctor, pharmacies, and they are like an Uber of healthcare. I mean, it's just that connecting the dot in that digital platform to connect all the healthcare entities, so that one healthcare entity can request a service, the other can provide the service.
okay.
um, so this is we they are still in the launching pad, and I'm having this discussion on their behalf, because what we are doing is we have some YouTube channel, Twitter channel, as you have seen, and we are going to publish this discussion. um, we were in the process of going into the market just when COVID-19 strike, right? And that's why we had taken a couple of steps back, and we are currently focusing on the COVID-19 and its informations to all our subscribers. So, as part of that discussion, what we are trying to do is we are trying to reach out to all the COVID-19, not all, some of them, the COVID-19 survivors, and try to get their stories and publish it to our subscribers. So, as part of that, obviously, you are the first one whom we reach out to. Um, so, that's the story, that's the background of this discussion,
Okay.
right? So, Louis, for benefit of our all the attendees, all the audience, can you just tell a little bit about yourself, what you do, and
Oh, sure. My name is Louis Molnar. I'm a former elected official in the US, but also in Canada. I currently work in data management for TD Bank. And I am heavily involved in a lot of community activities and some not-for-profits around autism, homelessness, and various others.
yeah, I saw your profile in Twitter, and it's very interesting. I mean, it has a wide landscape of work, starting from human rights to technology to educations everywhere. So you have touched base with everything. Now, coming back to COVID, Louis, I know you have survived, and you have survived this health pandemic in a big way. So, can you walk us through the experiences that you had, the feelings that you had while it happened, and the time through which you survived?
Sure. At the end of January, I had developed some symptoms of fever, headaches, achiness, that sort of thing. That was, of course, January, and at that time of the year, the flu is prevalent.
Yeah.
So I assumed it was the flu. Unfortunately, the symptoms got worse and worse and worse, and I became alarmed. I had been following the COVID situation since it really developed in November. When China started shutting down cities in early December, I knew
Mhm.
something was up. I had written a pandemic plan for West Park Healthcare in 2004, immediately following SARS. So I knew that we were overdue for something really big. And when they started shutting down cities, we're talking 16 million people, and lots of people, Chinese, were fleeing the Wuhan province or the area around Wuhan. It was, and they started mentioning numbers of 30 million people fleeing to other countries, and they were shutting down entire cities. And this was in early December. I said, boy, we've got something on our hands here. So I became concerned. when my symptoms really started getting bad. I had severe headache, uh, achiness, buboes. If you know what those are, buboes are an infection and a swelling of the lymph nodes.
Yes.
Very, very painful. They
Mhm.
feel like kind of like a pulled muscle in the area, but they're very hot to the touch, and it's obvious they're swollen and bruised.
So
And I
is
started getting,
that one of the symptoms? Sorry to cut you short. I mean, is that one of the symptom? Because that's news
I'm
to me.
not sure if it is, the CDC just released an additional 30 symptoms, and
Mm-hmm.
those keep changing. But honestly, the buboes thing is it could be an individual's response to
Okay.
the
Yeah.
virus. I mean, some
Yeah.
people, for example, get encephalitis from it. That's when
Mm.
the brain swells and that can cause hemorrhaging in the brain, and it cause additional fevers because there's pressure on the spinal cord, so the body just kind of goes into overdrive. There could be, if you're younger, 30 to 40, you can end up with what's called a cytokine storm, and that's when the body overreacts and starts kind of fighting itself. It doesn't know exactly what to do, and encephalitis in some cases can mimic some of that in localized areas. And I'm not a medical professional, but I did study this. I did write the pandemic plan for West Park Healthcare. It was used in legislation for the pandemic plan here in Canada. So
Mm.
I did quite a bit of historical research and also spoke with a lot of frontline professionals that are used in government. So at any rate, with my case, I got buboes and I got the fever, and it went on for 2 weeks. I was coughing up, and I won't go into a description, but I'll say it was really nasty. And it was obvious that something was going on. Um, I really and truly felt like I was on my deathbed. And I was calling people at that time and I was saying, I don't know if I'm going to make it tonight. I really feel that way. I had gone to the hospital, but I was sent home with flu. And I even contacted my general practitioner and she said, oh, well, it sounds like a cold. It was not a cold. I know a cold. I've been through enough of them in my life. I'm in my 50s now, so I've definitely done that. Um, at any rate, so I did get over it, but uh, TD, my employer, did mention in January that if a person is experiencing any kind of cold symptoms, they need to stay home. So my isolation began in January of this year. So I started feeling it 90 days ago at this point. And I certainly health wise had started feeling it in January. The exhaustion afterward was really bad. There were so many days, even after I knew that I was getting better, that I was going to be feeling this for a long time. And in fact, it did impact my work, although TD is quite supportive, and we know that we have a situation in February. Everybody was well aware something was coming up. In March, uh, the exhaustion had not gone away. This was 4 weeks later. And I continued to make I have two children to take care of, and the first one got sick, and the second one got sick, and um, so as I was recovering, I was also trying to help them get through it. Well, I got sick again
Oh,
in
really?
yes, in mid-March. I got sick again, and that time I went to the hospital. This is
Mm-hmm.
Ontario, Canada. Ontario, Canada, Toronto was one of the first cities in North America, actually the first to really start getting the cases. They're the first city that reported going over 50 deaths and 50 cases and 50 deaths. And
And this is the time around when Washington State in US were getting the first initial COVID-19 patients.
this is before then. So it
Oh,
was
this before
early
that.
March. Yeah.
Okay.
And so Washington and all of that happened mid-March. something
Okay.
like that. It's hard to believe it was only 6 weeks ago, but that's how
Yeah.
these things go.
So
It's very
the
quickly.
whole world has changed.
Yeah, absolutely. It's there's a lot into that. But at any rate, I got sick again, went into the hospital. I noticed that they were not accepting when I was taken in an ambulance to the hospital. I felt like somebody was sitting on my chest, and I started having panic because of that. So I went to the emergency room, and they admitted me right away to a negative pressure room. And a negative pressure room is one that won't um, allow. There are two separate sets of doors. One that keeps anything in, and one that keeps everything out. There's a neutral area. They were dressed in hazmat suits, the white ones that you see with the big helmets on and that sort of thing. I was not the first, but one of the first to come in with these symptoms. What was alarming to me at that time in March,
Mhm.
after I had already presented previously with symptoms, and those were on record, what was alarming to me, and that we knew COVID was happening, was that the personnel were examining me and treating me and telling me that they were treating me for a heart attack. Of all things, after all of this had occurred in the situation we were in, a heart attack.
Did it
And
happen, or they
I did
just?
not have a heart attack. I know, my father had half a dozen heart attacks. So I know what a heart attack looks like. I've listened to him. I know what it feels like. This was pressure in my lungs. I could not get a full breath. I really felt that. It felt like someone was sitting on my chest, and I just couldn't get everything out. They gave me antibiotics, and um, and they said I was dehydrated, which is possible considering I wasn't really able to take care of myself as well. And I got sent home that night. And I was there for 6 hours, uh, and they determined, yeah, that was a problem. I then subsequently the next day went to my physician, my general practitioner, and I said, I want a full panel of blood work done. I want to figure out what's going on. We had, by the way, cotton swab of my
Yeah.
nose taken for COVID the
Mhm.
day before. So the next day, of course, I went to get a requisition form for my blood work. My blood work came back within a few days, showing that my liver was decimated. It was absolutely destroyed. The I know that the physicians, and I remember the night before, they were pressing on my liver area, and they said, "There's something seriously wrong. Here, you're drinking too much." Well, I don't drink, so I knew that that wasn't the case. So then we got the blood panel back from the requisition from my general practitioner, and she said, "Yeah, we've got to stop some of your medications. I take several medications for this and that." And and she said, you've got severe liver damage, and we have to stop everything. And I said, well, there are a couple of things I need, but I'll stop taking everything else. So
Is it because of the antibiotic, the liver damage?
no, because the liver damage was present before I took the antibiotics,
Okay.
and I wasn't taking antibiotics before that. There's
Mhm.
something about it, and I do believe that, as I was dehydrating, obviously, and maybe I wasn't getting enough hydration or something. I can't say exactly why. And I'll tell you this, nobody has any idea. I've been paying attention to news reports and that sort of thing, and a lot of research papers. I read the full research paper. I don't read excerpts and Cole's notes on those sorts of things. I read the actual papers. I've written some myself, so I know how to look at those. And there isn't anything that that really pinpoints exactly why right now there's so much liver damage. Um, we can just postulate that maybe hepatitis sets in of some sort maybe during all of this. Not necessarily any of the viral ones, but who knows?
Yeah.
Um, I've heard from physicians who I speak with that are actually working in one who is a hematologist in Boston, where I sent my blood work um, we were not giving they were not allowing us to have um, the antibody test here in Ontario. So I had it drawn at a lab here in Toronto,
Mm-hmm.
and it was sent, and I sent it off to Boston to uh, my physician friend who's a hematologist there, who's very interested in it. He works in both liver diseases and also blood, and so um, they did the test there, and they found out that I had the antibodies. Well, the antibodies only show up, that test, 4 weeks after you've had it. Well, I just had it the week before, so it could not have been from that. So that told me in January then I had it then. So
Okay.
that's the timeline of how I knew how it happened. And I'm even now, I'm some of the symptoms that I have today. Just difficulty concentrating, irritability, quick agitation, um, achiness, the bones and the muscles and everything hurts. Um, so those are some of the things that I have. Just pure exhaustion. I mean, a
Mm-hmm.
couple of days ago I had to take 3 naps in one day, and those are an hour each. And really, 15 minutes once a day would have been enough before all of this. Now it just seems like I can't.
So how are you feeling now?
That's what I'm saying. These are all the things that I'm feeling now today. And I emotionally, I know that we've got, personally, I'm going to be fine, and everyone in my household is going to be fine. The challenge that I have as someone who has written a pandemic plan and who's paying attention and has been paying attention since November
Mm-hmm.
is that people don't realize that there's a second wave coming. And the second wave occurs typically because they loosen up restrictions
Exactly.
when things start looking better. And that's
Mm-hmm.
actually when one should not. But given the fact that it looks like there are, what was the report, 30 different mutations already? It's kind of
Mm-hmm.
like the cold virus. You can't, at that point, you can't really have an inoculation or anything. Even a treatment would be challenging. I mean, remdesivir, which is often used for as an anti-HIV, it's an antiviral, and some retrovirals are also using those sorts of things. They believed might be useful, but I mean, who knows? I am currently on a PrEP and Truvada, which is it limits viruses and that sort of thing. Remdesivir is used for those purposes. Um, did not work on me. It might have helped me live. I don't know, but it makes you wonder if that might be, if that would even be effective. I just wonder. So that's where I am. I'm really concerned about what's coming up, and the fact that in the U.S., especially with some of the largest number of cases, certainly the
Yeah.
largest number, not necessarily per capita, but the largest number of cases, they have not even had an explosion yet. So not in the way that they would.
So
So yeah.
talk, talking about the US, we saw what happened in New York, one of the most rich state in US, right? And
Mhm.
one of the best healthcare infrastructure. We saw what happened and what's happening there. Did you, in Canada, did you guys face the same situation with the healthcare infrastructure not able to cope up with the demand? of COVID-19?
We have not yet hit that, and it has a lot to do with the fact that Ontario shut down, or Canada in general shut down in February. It was one of the first countries to do so. We looked at Italy and saw that they took too long,
Yeah.
and we were just not, I'm sure we were just, based on what the prime minister's been saying, he said we're not going to do that. In fact, he extended the shutdown to September, I believe it is now. And then he said, and he's been wonderful. He's been very honest with the public and saying, look.
And I would like to tell you, like me, there are a lot of other fans of Justin Trudeau. So, I mean, we all love him, the way he handles situations. Yeah, so.
He has really done it well. And the most important thing was transparency. And he said, look, we know that everybody is having challenges. This will last until next year in one form or another. And the world that we had before is never coming back. It's not, it just can't. We're going to change mentally. Our economy is going to change. The industries are going to change. We've got, there are long, reports are out that you're going to lose 12 years off of your lifespan just by having it. And that can cause additional medical complications. I myself have severe liver damage still. It affects me every day. I have to be very careful about my protein intake so that I don't, that's hard to process by the liver. Fattening foods out the window. I'm on an, I do a natural holistic whenever possible. So I have my ginger, I eat lemons, whole lemons, a little bit of salt to help them go down, but because that really helps out with liver regeneration. And I do those sorts of things, some spicy foods to help process, some of the fats easier and that sort of thing, and proteins. But I am limited on what I can do by conventional medicine in terms of what I can take right now. I really can't take the medications that, one would for, say, fatty liver or some other liver aids, because my liver is so bad off, I can't even take those. So it's a real challenge. And it's a good thing I led a healthy lifestyle. I do exercise a lot and that sort of thing, and eat quite well as a vegetarian forever and a day. And so it's been tough. It's been really tough. I'm not concerned so much about my health as I am about the people around me, my family. And I've let them know at work I'm not going back this year at all. So don't even look for that. So it's a challenge.
So looking, talking about your health, and you look strong. You look physically fit, at least to me. And having crossed this COVID-19 situation, how do you, mentally, how do you feel like that, even being very strong and physically fit, you had to go through this crisis? What is your advice to other people who thinks that, okay, I'm very immune to all these things?
The fact that is that I did work out every day. I'm in tip-top shape, certainly for my age, and I got it not once, but I got it twice. And the fact is that, people like to focus on older people, but the fact is that younger people are, according to reports, more likely to get it. Number one, because they don't socially isolate. So socially isolate, or physically isolate, like they're saying now, physically distance. You can't, people that are overweight, diabetic, that sort of thing. In the U.S., if anybody's listening to this, we've got, 2/3 of people are overweight or obese. So we're looking at a real chance of getting hurt. If you are currently experiencing any of those symptoms, take it very seriously, and realize, as in my case, you can get it twice. In my case, it didn't last as long, but maybe you have it in a minor way the first time and then major the other. We just don't know. And so it's important to take care of yourself, understand that, we may be going a little bit stir crazy, and that this may last another year, but at least you'll have that other year if you're
Yeah.
careful. You'll have the rest of your life to get over it, and to appreciate that. Um, there is no season that is guaranteed. And aside from a philosophical statement like that, we have summer here in the northern hemisphere. Okay, we'll have more summers. You will be able to get out onto patios and beaches and things like that sometime in the future. But you can enjoy it from your window. It's just one season, 1 year, and then we'll be over. So
Yeah. Um, so coming back to your experience, right? You have been gone through this crisis twice. Um, during this time, you have interacted with health workers, government entities, and then the media, or even on the periphery of it, all the peoples who are part of the medical system, right? uh, what is your experience with them, like the health worker, and how government entities were helpful? How media, do you think, did they act responsibly, or there was a kind of a um, hysteria created by media?
one of the challenges that we had noticed in Canada, and I'll speak about Canada first, and this isn't, um, there is a tinge of um, criticism to it, that over the last 20 years in Canada, we have had a reduction in healthcare services, healthcare providers, hospitals, and emergency rooms.
Does it include the budget? The budget also
Yes,
was
absolutely.
reduced.
That's what did it. Yeah. So the budgets have been slashed horribly in Canada. And as the person, that had written a pandemic plan, I thought, oh my goodness, we can't do this. We're overdue for something, historically looking, in terms of a pandemic. And we had come after, and this is right after SARS. Um, so I just, I was flabbergasted. And then, of course, we had additional shutdowns in Ontario, with the current government. Um, that's a huge challenge. The fact that in Ontario there had been quiet, Trudeau's great, the federal government's great, but some people, look to their local leaders for
Yeah.
advice and for, support and that sort of thing, and it was not forthcoming there. We can speak about the U.S. and the fact that they've only just come to recognize that something's going on. And it's been politicized left, right, up, down, and center. The fact that governments all over the world are reopening their cities and their parks and their beaches and whatnot is a political decision. That is not one based on the facts. It's not based on science. It's not based on medicine or the numbers. There's no excuse for them, and that is happening. So that is concerning to me, that it is being politicized. This is not a political situation. It is an economic as a secondary situation, but it's first a medical situation, and a pandemic even goes above and beyond that, because there's the mental health cost and that sort of thing. A pandemic has those kinds of things. So, there's going to be a lot of borrowing going on by governments, and that's something that needs to be accepted. People are talking about their rights to be out and be free, but nobody has the right to expose someone else to something that could kill them. So it's concerning. We're starting to see a breakdown of, the food supply lines all over the world. That's going to be a problem coming up. We're already seeing the protein, because it doesn't last as long. The meat does not, it has a very low shelf life. Of course, you're going to start seeing those things that have the lowest shelf life start breaking down until you get down to the grains, and we've got a problem. So we're starting to see that, but there is no government action right now to really shore that up. I mean, to do supplemental nutrition, such as instead of chicken, like in the US, instead of chicken or pork, we're going to go with beans or corn or something like that, something that will help supplement what you would get normally from those sources, because those sources are going to continue to go down. So those are some challenges with the governments and how they're reacting, and some advice, I suppose, of what they could do. But otherwise, I'm hopeful, despite all of this. I'm hopeful that
we all have to be optimistic at this situation. I mean, there is no way we can be negative, and obviously try to solve the problem as a community rather than an individual. So coming back to one thing, Louis, have you traveled in recently? Or do you have a
Oh no,
travel history?
oh no, I have no plans to travel. No,
No,
probably.
before you got into
Oh, I
COVID-19.
had a lot of plans to travel. Sure. This year I was in the process of purchasing a house in Lucana, Italy, which is just west of Milan. But, I was supposed to sign the papers in April. Once all this started happening and Italy started really getting its cases in January, I canceled the contract. Yeah, for sure.
So
You got to
did
do
you
any.
travel? Yeah, did you travel 6 months before Jan? Or,
Oh, no, 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 no. I didn't travel
so
anytime
no travel
before that.
history.
So no travel
Because
before that. No.
yeah, the reason I'm saying is this all started with the traveling.
Yes.
If and then within the community it gets spread, right? So I was just asking whether you had a travel history, or is it within the community spread that you got
Yeah,
something.
I'm not sure where. I mean, I live in a major city, right, in Toronto, and public transportation is a huge part of this. We're not as much of a car city as, say, a lot of other North American cities. So we do a lot of subway stuff.
Yeah.
So I had not had anybody visit me that I'm aware of. Although, it only takes one person coming in from, our Pearson Airport, which is our major, international airport, to then get immediately onto the subway, and then that's it. So, and that's not to say, we know that in a lot of cases in North America, in New York, the cases had come from Europe, and so we have a lot of traffic coming from New York. It could have come from New York, you know.
So
Yeah.
New York and London both has a subway. But I want to pick up another subject here. You talked about the obesity as one of the reasons. I mean, who are more vulnerable, right?
Yeah.
The people with the chronic disease, right?
Mhm.
You didn't have any chronic disease, right?
I do have porphyria, and I've talked about it quite a bit, and that's a condition where the body under high stress, the components that go into making up, blood cells and heme and some of those challenges um, start to occur under high stress, and then those components break down and they start basically corroding the inside of this, the system, from within, because they become kind of poisonous. So, yeah, I had that. I don't have any other health concerns. No, I did not.
So coming back to like what we had seen in New York or in London, the
Mhm.
people from the lower income group, they were more vulnerable, and there was more death in both the cities for the people with the lower income group, or maybe minority or ethnic minorities, right? Do you think it's because of access to healthcare, and in some parts of the developed world healthcare is still a privilege?
And you're talking about the US, right?
Yeah.
The challenge with the lowest income groups is in most states is not access, because in the US there is a law that it's well there's a law that states that no hospital can turn away anybody that needs help regardless of their ability to pay, and it specifically says that. Now, I said access, but what I mean more of is accessibility. So the accessibility is there. The challenge is that people can't afford to get sick. So they will go to work. The people that are the poorest, the ones that have the hardest times, the ones that live most paycheck to paycheck or even negative check, as I call it, when you can't even your paycheck won't cut it. Um, that's the challenge, is that they have to work even when they're sick. And so those are the people that will continue to spread it. And if you look at a map of say New York in its 5 boroughs, and you even have the most basic knowledge of neighborhoods in the boroughs, and I lived for 7 years in New York City, so I know.
Yeah,
Um,
I was in New York City for around 3.5 years.
yeah,
So
so if you look at that, and
mm,
you're looking at North Manhattan, you're looking at the Bronx, you look at Jamaica and Prospect Park, and then east of that, and then certain areas of Queens, and you start
yeah,
seeing that
Queens.
those are also the areas that have the highest levels of redlining and that sort of thing. And redlining is, of course, when you draw lines within electoral districts based on your voting base and racial um, um, demographics and that sort of thing. Highly illegal, however, it still happens through gerrymandering in the U.S. So yeah, you see that. So the challenge is not so much accessibility as
But
it
the
is.
affordability.
Yeah, it's well, a lot of people accept in the U.S., unfortunately, that if you get a major illness, that you're going to go bankrupt. They
Yeah.
the price of going, they accept it. Even with insurance, you're going to have um, a hefty bill. That's just how it is. Staying in the hospital for a week with COVID will cost you 75,000, and there are not very many people in in the US that can afford that sort of thing. I mean, I would think myself, I'd rather put it down on a house or something like that. But just so those things have long-term effects on the economy and other industries and that sort of thing. But yeah, it just more profoundly affects when 75,000 is what you make in 2 years of your working life. It starts to
Yeah.
really impact you like that when you think about it, and you're living paycheck to paycheck and you subsist on payday loans and all kinds of different things. It's a real challenge. So, um, but those are systemic issues, and one of the reasons why, unfortunately, I have multiple nationalities. I have U.S., Canadian, Hungarian, Irish nationalities. An accident of birth. It's not because I sought them. But one of the reasons why I said, when I'm with my kids, and they're getting raised in Canada, because the healthcare is number one. You start
Yes.
thinking like that. And then, of course, I had my own challenges, despite the fact that I'm highly employable, highly educated, and all that kind of stuff. So, but still, it becomes that. So, It's a real challenge there in the U.S. and they're wealthy enough that they shouldn't have those issues. You know.
So coming back to Europe, they have more egalitarian healthcare system.
Hmm.
Where do you think they failed? Why there are so many deaths in UK, Italy, Spain, and now Belgium, France? Only Germany is one of the brightest spot here.
Germany, unfortunately, Angela Merkel is very smart, but she's also a political animal, and we can't forget that Germany just reopened, so so we don't know yet, whether they're
Yeah.
really doing a good job when they just opened. That's pretty nuts. Um, but the countries in Europe that you find the biggest challenges are those that have adopted over the last 20 or 30 years a hybrid system of healthcare. That is that you'll have your primary healthcare like the NHIS in the UK, and then you can also get supplemental health insurance. Well, that'll put you, it's like a two-tier kind of system where the people that have the additional health insurance or other things will then get better care. And the challenge then is that you're ending up with more and more of the healthcare system starting to lean on private. And when that occurs, it becomes this cycle of, oh, well, we can lean more, we can lean more. And then as the insurance companies begin to have more clout, more money, they then feed that into the political system, which gives them more power and more power and more power. There have also been, in the UK, just using it as an example, healthcare cuts. We know about those have been happening. The leaks in the ceilings of hospitals, that's been going on for the last 5 years. It's really big time. So that's where you will find those challenges is those countries that have adopted more of a hybrid system. Italy doesn't have as much of one. They're more of a traditional, universal healthcare system. The challenge is that they have that they closed down too late. They really did. They took their time about it, and that allowed it to really get in there. But my biggest concern is with we talk about that, is with the U.S., where the per capita number of physicians is drastically lower than anywhere else, for any of the G8 countries. Very low, even between Europe and certainly lower than any other country in the G8. So they have not really been hit yet, and they're only just now starting to get those rural cases. So I don't know, but yeah, I think it has a lot to do with if you're poor, if you're in one of those countries that has either no universal health care or a hybrid system, if you are a minority living in an ethnic neighborhood. And that's the challenge, is a lot of people that live in those neighborhoods are maybe not, maybe middle class people will live in traditionally poor neighborhoods, that sort of thing. They're going to take it into their environment and, where they, outside of where they live, where they may congregate and that sort of thing. So, what happens in one place, definitely, I mean, we're social animals, right? Whatever
Yeah.
happens, that's the most important thing. That's why we want to get out and we want to go to the beach and we want to see other people. People are complaining about, I want to work. Well, they're already working. No, they want to work with other people. They want to be with other people. That's the challenge. And then, of course, with that is the reason why we have a pandemic, because we're shaking hands, we're hugging, we're kissing, all that sort of thing. So,
So,
yeah.
so staying on countries, I mean, we talked about America, we talked about European. I'm from India, and we are from India. We are a country of 1.3 billion people. But if you see the cases in India, it's so low. We are in lockdown for almost like 6 weeks now.
Hmm.
Um, how do you think that India is handling this situation?
I was reading an article about that. I think it was last week when it's, the number of cases is so low. But I think I
Yeah,
don't
I'll
know
tell you
what
one
it
thing.
is.
I'll tell you.
I would
Sorry
like
to
to
cut.
hear from you about that.
Yeah,
I've
I,
got, I've got a theory about reporting rather
yes,
than, and the fact that in access, although there are definitely different levels of access to healthcare in India, big time. In
yeah. I
some
mean, India
areas,
is not a structured healthcare system. It doesn't have. It's a very minute healthcare budget.
yeah,
Government after government never focused on healthcare, though this government had put some focus on the healthcare.
right.
And I think the major part of India, why we are seeing so low cases, is because of so low testing. So government is saying that maybe from next week, they will have 100,000 testing per day, and I'm sure once we go to that level, you will see the cases rising.
Well, what the testing that needs to occur is the antibody test. And right now, they're currently testing for active virus. It's just like what happened with me with the nose swab. I got that, came out negative. As I was as I was
Okay.
sick with it, nothing. There's also the testing is incredibly immature, where at least a third of the cases are false negatives, right?
Yeah.
So that's out. Everybody knows it. That's the truth. One third of the time you're going to get a false negative. There's a lot of what they call undetectable, so you don't even know if that's because the test just came out neutral, and then you have the positive. So then there's I just don't think that we even have the facility, never mind the capacity to even be able to have accurate testing and reporting and all of this. So I think this is going to be one of those things, honestly, where it's only when you start counting the bodies that you start realizing what's going on. Both, physical corpses and then also antibodies, right? So it's going to be that thing. This is something that we're just not going to. It's like the 1918 flu. We just won't know the full impact of it and what the repercussions are for decades. I really feel that, and it is, and that's the tragedy of it, and especially of a species. And in medicine, we want to know what's going on right now. We rely on research, and we know that research is always way behind the ball, right? Research comes because you were looking at something a year ago, so it's like that sort of thing. So and to go to that with India and the healthcare and with Asia in general, the population levels are so high. I just don't, and the people are condensed, that I just don't know. I don't know how you can get anything accurate from
Yeah. Yeah.
high
Yeah.
population levels.
Yeah. Um, Sorry, I got a knock on the door.
Yeah, at least it was a
So,
knock.
no. I mean, I have few more questions. One is, I mean, let's talk about the mental health, right? I mean, you have been through an isolation,
Yes.
because you had been a patient. But because of this lockdown situation, apart from patients, the people who are generally healthy are also in a lockdown situation,
Yes.
and they are within the doors and windows of their own home. So there have been cases of domestic violence, mental crisis, mental health problem. What was your experience, and what do you advise to the others who are going through the same crisis?
The biggest uh, the thing that has the greatest benefit on mental health is strangely enough the things that everybody talks about, and that's lots of regular exercise. Variety is less important than you think, and you know it is. Um, Being outside in one form or another, to see nature, feel nature, know it's still out there, rather than the four white walls that, or whatever walls that we have. Healthcare, keeping in contact, even if on the phone, even if Skype, like we're doing right now,
Yeah.
with others. Texting, we've learned through this crisis that texting does not have the positive benefit that we thought it did. Nothing will replace voice to voice or face to face communication. That's just not how our brains work. And so I'd like to see some of the research coming out of that. The mental health thing, yeah, we've got to do the things that we know to do, eat right. Unfortunately, we've got substance abuse issues going on right now. That's bleeding into that. We had a mass shooting in Eastern
Nova
Canada.
Scotia. Nova Scotia. Yeah.
Yeah, recently. It was blamed on a fight with his girlfriend. Afterward,
Yeah.
he
I
said
saw
he
that.
had they were on lockdown and he had a hard time, and then you know so we're seeing a lot of those sorts of things. We're also seeing people that um, are susceptible maybe to some people who are over politicizing this situation and calling it a liberty issue. Um, and so that's why we ended up with the Michigan State House. Can you imagine that? Can you imagine they went and they overran, the governor and members of the legislature had to lock themselves in, the state house, and have those armed guards in front. And then even then, the militia people with armed weapons then pushed them to the side and stood in front of the doors because they weren't allowed in, and they were beating on the doors to try to get in the legislature. Can you imagine? As a former elected
Yeah.
official, I
I
can
mean,
tell you.
so it's obviously political, and it has the backing of a very strong leader. So coming back to two things. One, we will talk about what is the cure, what is the exit strategy of this COVID-19 situation, whether it's lockdown, the economic crisis, the health crisis, and then we will talk about the vaccine. What do you think will be the cure going forward? And can herd immunity will be able to, um, we will gain that immunity within 1 year, or it will take several years. So can we talk about, first of all, the vaccine, do you think, and the herd immunity part?
Given that it's incredibly virulent, and I guess there's a pun there too, um, that uh, the evolution of the virus and the fact that it's mutating, 30 times in a couple of month window, is more like a cold virus, right? Cold viruses is the reason why we don't have a any kind of vaccine, any kind of inoculation that you can have to protect against it, because it just changes too quickly. And that's just what we've studied. We still don't know what's out there and how much more it's mutated. So I really do believe that a vaccine is not possible within the next 3 or 4 years. It's just not, if ever. What we would have to do then is to rely on either just treating secondary infections with antibiotics, because antibiotics only work on bacteria. They don't work on viruses. Okay, so you'd have a bacteria that says, "Oh, this immune system is down. Let's make this worse than what it would be in that body." So then that's where the antibiotics come from in treatment. But I do not believe there will be a vaccine I believe that we may have some antiretrovirals, although remdesivir, those kinds of things, they haven't been. A lot of people like Dr. Fauci, in the U.S., Anthony Fauci, has said, I don't think it works. There isn't going to be anything that works. In which case, then it comes down to everybody's got to get it, and whoever's going to die is going to die. And it's called herd immunity, where some people will be isolated, and everybody else around them will get sick until it dies down. And then those people that were completely 100% isolated, which good luck in modern society, will then come out onto the streets and into the population, and everybody else will be immune or not able to pass it or whatever, and that's herd immunity. So I'm a very hopeful, positive, glass half full kind of person. I do not believe that we're going to have anything that's going to be truly effective within the next year. I just don't see it. The testing and trials and growing vaccines and that sort of thing take at least a year, 3 years. So, hopefully we'll get something, but I just, based on current research that I've seen and some of the experts that I've talked to, it does not look promising right now. So, but I still hold out hope. We talked about that from the beginning. So, yes.
Yeah. So do you think that this lockdown in some form or the other will continue for years to come?
I don't think for years to come. I think it will, based on my research, and I've shared this with elected officials and people here who are focusing on that sort of thing in Ontario, members of parliament and all that sort of thing. I've already talked to them, and my prediction is the second wave will be around August, September, or something like that, and then we'll go into overload of lockdown. I do believe the lockdown, the isolation, the confinement will continue until probably January next year, February. And then the final
across the world, you are saying?
Yeah, I would say probably January. Not here. Here it would probably be March in Canada, in some form or another in Canada. Mm-hmm. I can't say then, what that'll look like for North America, because if they keep it up, everybody's going to have caught it and be over it sooner, maybe. I don't know. And whoever's going to die is going to die. I guess that's their plan. I don't know. It just doesn't seem like they really have one. But yeah, I think for Canada, it would be, probably January next year, January to March, something like that.
Okay. So, talking about the economic fallout, right? Okay. Especially for the people who work on a paycheck to paycheck, who are contract labor, the people who somehow make live their life within the paycheck. Yeah. They're going. Do you think that they're going to survive this situation?
Yeah, they're going to survive. They're going to survive because, we do have social safety nets that do exist in most countries in the world. In some way or another, there is. And what I do believe is that the spirit and the power of community is really going to kick in. It hasn't yet, but it will. Where a person will stop looking at their own personal consumption and their excess, and they'll start saying, oh my God, look, my neighbors are dying of starvation. And I'm not going to say that's going to happen, but that's the mentality of the spirit of community and cooperation. And that spirit, that survival, that oneness is already starting to feel it and start hearing about it, and people are starting to use a lot more terminology, even if you go on Twitter, for example, where they say, stay safe, be healthy. you're seeing that all the time, and for people that would not have done it before then. So that being said, if that mindset will continue to spread, and even elected officials, as much as they feel pressure from other things, will start paying attention more back to the constituents, the people that elect them. And then we're starting to see, for example, I'm on Bay Street, which is like the Wall Street, of Canada, so that's where I work. And a lot of I'm part of a lot of groups that are executives and managers and, leaders, thought leaders in some cases of that. And even the executives that are hardcore Bay Street type people are in the mindset now and openly saying, what can my company do to help people who don't normally have access to some of our resources? So, for example, in TD, where I'm working, we are opening up some TD Wealth, for example, is giving financial advice. That's coming up in June for free. Also offering a different kind of range of products and that sort of thing to help out in the short term. In the U.S., and certainly here in Canada as well, we're beginning a universal basic income, which is a full income replacement for people that don't work. It is not people who are unemployed. It is not people who are disabled.
Yeah.
It is not people who are elderly. It is for everyone to claim. If you are working, you are not entitled to that. But anybody else, you have this income. So we're doing that. It's $2,000 a month here in Canada. You can apply if for whatever reason. What we're finding then is that we've got cases where people are making more on universal basic income than they were making before, which is triggering this whole other concept of, hey, wait a minute, why were they not making more? Why were they not making enough to live on at that time before all of this? So that's triggering this whole, conversation, this dialogue of what is an acceptable rate to pay people. So that's going to have long-lasting impact. And so when we're talking about that, I do not believe that anybody, I don't care how much, we are human beings. We are, we rely on relationships. I believe that even two diehard enemies, if one saw the other truly suffering, starving or something like that, they would give them their food. The one would give the other one, enough to survive. We're getting to that. We're getting back to that. It's wonderful to see that. And that just starts not only the community, but it goes into a larger one. It's we're in Canada. We've got huge calls for pausing of rent, mortgage payments paused, all those sorts of things. People don't in Toronto even, and I'm trying to think what the other city was. I think it was Houston. The hotels and some affordable housing units were opened up to let in their homeless people and people that are at threat of losing their homes. Eviction notices have gone up, but the evictions have actually gone down. So I do believe, and that's a long way of putting out there, of answering your question. I'm sorry about that, but yeah, I do believe that there's enough that
that we can share.
That suffering, yeah, that there will be shared suffering. I just have to say that.
Yeah. So you talked about the positive aspect of the human or the society, the human society's cooperations, right? Stay
Yeah.
safe, stay healthy, and getting some pay cards and sharing some of the wealth, including food, the very basic necessities. But on the flip side, we had seen, I mean, we hope that all the old prejudice will be gone because of this crisis. But we do see that there are some, though it's a smaller section, some corners of xenophobia, racism, and attacking specific minorities, specific communities, um, and giving it's like blaming them for the crisis rather than solving the crisis itself. Do you think that we will get over it when this crisis we walk past the bridge?
I think about I think about the human condition and mutual suffering and respect because of suffering. Um, during World War II, there were many stories of the front lines. You had particularly among the British and American and the Germans and their allies. During the day, they're trying to shoot and kill each other. Literally at night, they would all get together and drink and party and laugh and joke and get to know each other. Then they would go back out. They would fire at each other during the day. So that tells you that when it comes to survival and suffering, everything changes. And if you've ever been on the front line, you understand that it's really hard to hate somebody that is going through what you're going through. And so that's a huge change. Yeah, and that goes into other conversations about, and also, harkens back to some of the conversations we had earlier here. Yeah, I don't know. We're looking at major changes, the xenophobia and all that kind of thing. I believe initially right now it's ratcheted up, but I do believe that it will. I think that's kind of expressing a wound. It's getting rid of the negatives, the bad stuff. So because I do believe we're after this is going to be a better place.
So hope we all cross the bridge together. So let's hope so. So I have two more questions to wrap up this whole discussion, and both are for the future.
Mm-hmm.
The one on the lifestyle. Do you think after this COVID-19 situation, once we get over it, once the dust settles, do you think we'll go back to our old? We can go back to our old lifestyle,
No.
or it will never be normal.
Yeah. The thing is that there's a simplicity that is forced on us, and that is either here we are, we've got restaurants and everything else locked down, right? We've got if we wanted clothing, we previously could have gone out to our shopping malls or whatever and gotten what we needed. Now sewing machine sales are through the roof, and so people are making their own clothes. I mean, I myself have been working on hats. I've been making my own hats for the kids, and I've always sewn. That's always been my thing. But now we've got a lot more time, so we're doing things like that, clothing, and all of that. But that also leads to cooking. People don't have restaurants to go to, so if they want spring rolls, for example, or they want anything else, they've got to make them themselves, and they're learning how to make it. And to be frank, the one thing that unites us all, the thing that we most look forward to, the thing that everybody shares, is a common love of food and kitchen. It is the cultural glue. And when you're making you're in Africa and you're making tacos, Mexican tacos, you're going to learn a little bit about that culture. It's
So what kind of food do you like, Louis?
What's that? My type of food? I have to say, well, I'm Hungarian. I grew up Hungarian, and so I like that. That's my soul food, as it were. It's that the really earthy things. But aside from that, I've traveled the world. I don't think after that that I have anything that I favor except for if I'm not feeling well. And I learned this, over the last couple of months. I lean back on Vietnamese food.
Oh, well,
Yeah,
the
some
Vietnamese,
the spring rolls,
the
spring.
rice, the rice noodles.
Yeah, Vietnamese food is it's very super fresh, uncooked
Yeah,
in a lot of
exactly.
ways, just enough to get it. And then, it's hand prepared. There's a lot of where you're working literally with your hands. And then a lot of fishy kind of flavors, a lot, like fish sauce
Lot
is
of
really
lot of
big.
green and fresh vegetables.
Yeah. And I was vegetarian for a long time until last year when I started getting some challenges around meat proteins because of, you get older, things change. So I had to start integrating a lot more shellfish and fish and things like that. So I was vegetarian for 30 years, and then just started getting some more fishy things in there. And so then it made sense to start using a lot more Vietnamese. And now I have Vietnamese every day. Yeah. So I don't know if
So
it's my favorite, but
we are
it's
not going back to the old world then.
what's that?
We are not going back to the old world then.
No, I no no I just don't see that there. I mean, the human beings have an attention span of, you know, really under normal, not technology conditions, under normal conditions of a few months. It's about 6 weeks to a few months. But that's why political scandals only last 3 to 6 months maximum, right? This is going to go on for a long time. People are going to get used to it. And
Yes.
then they're going to be more local. They're going to not travel out as much, so cars are going to go down. The sale of cars. Um, People are going to shop more locally. They're going to live locally. They're going to work locally. They're getting to know who their neighbors are, right? So they're thinking more locally. Um, Once you get used to it, it's not going to go away, and it's easier to be local than to get in your car and drive. People used to drive out, 12 kilometers, 6 miles, whatever you want to call it, to go and go pick up a certain thing. Well, now we can have it, number one, delivered, or we've learned to do without it. So, you know,
Yeah.
yeah, big changes,
So,
big, big, big changes.
yeah.
Yeah.
Speaking of the future, I mean, even last year we were almost losing hope of saving this planet, the environment. But do you think the COVID-19 situation is blessing in disguise to? I mean, we in India can see a drastic change in our environment, the
20%.
pollutions.
Yeah, 20%, 20%
Yeah,
drop overall in pollution in India alone. And 8% globally already the carbon emissions had dropped within 2 months, 8%. I mean, they said, and this is the thing, they said, number one, it's not possible. The industries and governments said, oh, it's not possible to have that kind of drop because we're looking for a 20 to 25% drop. Well, look, we did it in 6 weeks. So now there's no excuse on
yeah,
that.
exactly,
There is no
exactly.
excuse. And we do know that benzene levels dropped 75% in cities like Houston, Texas, where the refinery shut down because of the oil situation. Benzene dropped down. Cancer rates are going to plummet. And then people are going to go, now, wait a minute. Why were we putting up with this before? It's going to be these sorts of things that, conversations that people are going to have. I think, I actually grew up in Houston, Texas, so I could talk about that and talk about the fact that we used to have refinery explosions where these black balls of tar would rain down and you had to close the windows of the school and everything so that the toxins wouldn't come in because where they landed is where you were going to end up with a tumor. So if you were outside, you were going to end up getting horribly sick. Never mind the pollution that was coming out and everything. So I think that we're coming into a cleaner world. We're coming into a closer world. We're coming, I In this way, I guess, I'm a realist, but I'm also a philosopher, and I do believe that the universe, and I do believe that the world has a way of resetting itself and putting itself where it needs to be. And I do believe that human beings, as much good as we've done, we do need to be checked sometimes. I think we're children, and Mother Nature has a way of doing that. And I think that this maybe is exactly what we needed.
Yeah, I mean, I'm sure most of the people are enjoying the weather, even if they cannot enjoy the lockdown at
Yeah.
least. So I hope this discussion, this conversation goes on for a long time, but we are short of time, and this is my last question. Yuval Harari had said that he's obviously Israeli historian. Um, he said that COVID-19 situation is a watershed moment in our political and social history.
Who said that?
Will be
Yeah.
Yuval Harari.
Yeah, I can hear you.
Yeah, Yuval Harari had said that it can be a watershed moment in our social and political history, in the sense that whatever the rights, including our healthcare rights, we have won over centuries, we may lose after this lockdown,
Right.
because some governments of different parts of the world are trying to use to impose their own emergency situation on their citizen. Um, it includes obviously the
Mm-hmm.
freedom of rights, freedom of speech, expression, as
Right.
well as our healthcare rights, our
Right.
privacy rights. A lot of governments have started tracking their citizens. So, how do you see the future on the social and political aspect?
I think it's really going to be interesting because we're going to have entire industries going down where, there was what the things that we consider to be extreme far left liberal ideals 3 months ago, 3 months ago, such as universal health care, universal basic income, local use farming, even some conservative traditional things like way you raise your kids, making your own stuff at home, the traditional foods, these sorts of things. It's those are coming in and they are now normalized. It's very difficult now to justify allowing people to suffer, and that is the biggest change I think that we're seeing. We're going to see those are some of the changes. Some industries are going to go to privilege industries like restaurants, and I don't mean privilege in terms of access, because of money, but more of, well, why don't we do something different, this month, and we'll go to this restaurant tonight. I do believe also that as people get more, um, they're eating fresh foods, fresh made foods at home, their tastes are changing. So that frozen foods are not
Yeah,
going to be something that they're going to tolerate. You know, they're going to go into these restaurants and taste, oh, geez, where do they get their food? Oh, it tastes rotten, or whatever. As we start getting used to less proteins and things like that, people are going to start tasting blood and less fresh food and things like that. So it's going to be, that's on a very personal level. Never mind the economic. The economic is, unfortunately, it's going to be significant fallout. The U.S. is looking at the end of this year of having $30 trillion added to the deficit. Trump, it had gone down to about 4 trillion um, under Obama. In 3 years, it went up to 12 trillion under Trump. It's expected to increase to another 30 trillion on top of that by the end of the year, not only in the loans and tax changes and things like that, but economic. It's the impact of money not circulating. It's the lost GDP, individuals not working. So just that alone will do that. It is governments calling in their loans on the U.S., for example, that sort of thing, because they need the money, right? So they're calling in the loans early. All sorts of different things. There are going to be some significant changes, and that will cause austerity. But I do believe that under normal circumstances, populations will be okay with that because they've gotten used to a simpler life anyway. I do believe that. They're going to be like, well, we didn't need we didn't need to buy that new car because we're not even using the one we have now. Sort of situation, if that makes sense. So
yeah, I'll
lots of
try to.
changes. Lots of changes. Yeah.
Yeah. Uh, I hope most of the changes are more positive for our society
Yeah.
than the negative one. I just want to change. I want to end this conversation with one of my favorite topic, um, wealth inequality. Do you think that will change because of this? I heard you saying a lot of positive things on that part.
Mm-hmm.
Do you think that people are ready to share their wealth, their income, their hardship with others,
Mm-hmm.
not as a freeloader, but as a basic rights?
Well, I'll tell you this. Um, there was previously this idea that, a sense of shame over not being a millionaire or a billionaire, for the average individual. There literally was a sense of shame.
Yeah.
Those people, you look at Elon Musk yesterday, lost what, $12 billion or something. He's no longer a billionaire by a lot of people's standards. And certainly a lot of there's other people, but you don't find a lot of complaints about it, I'll tell you that. So you're talking about where previously people would have freaked out, the stock market would have gone crazy just over that one thing. People are thinking about what's really and truly important. And we've got the universal basic income, which is really kicking in all over the world. The the food availability, which is a prime example of inequality, that's all shifting so that it's more evened out. This is going to be the shift. And by the way, you said you made a distinction between good change and bad change. I think all change is good. All change is good because in a lot of cases the bad stuff will be put in front of people's faces. If it's bad change, they'll see, and then they have something to compare it to, which is, oh well, this is better. So I think all change in that way is good.
I agree.
But yeah, it's all the negativity is floating to the surface, and people are now looking at sources of information they would have never considered previously. And they're seeing the distinction between their beliefs and their selfishness in the past. And they are realizing, wow, I was a horrible person before. And that spreads to the way they vote, the way they dress, to who they talk to. I think we're coming into an amazing, amazing, wonderful place. And it is thanks to COVID.
Yeah. I mean, I hope this conversation goes on and on. I had so
We
many
could go
questions for
on
you.
and on for hours. I think so. I
Yeah.
really believe that.
Um,
Yeah.
but it's an absolute delight to talk to you, Louis, and hopefully we will meet again. Not very formal, maybe in an informal thing.
Why
Um,
not formally? Why
uh,
not? Why not? Why
yeah,
not? Why
we'll
not personally? Why not? All of that. Come and
yeah,
visit you.
yeah. Okay, so I will stop the recording now. Let me stop the recording.